Good day, and welcome to the Government House press briefing for the week of January 30th, 2023. Happy New Year. It is good to be here at this week's briefing after a couple months filled with engagements and activities. From festival and inauguration to the State of the Territory address, I want to first say again how grateful Tregenza and I for your vote of confidence and support. We ask for your prayers and support as we continue to lead our territory on a path of prosperity. Thank you. As I mentioned, we have had a really busy couple of weeks, actually months here at Government House, and the work we're doing on behalf of the people continues at the pace that it always has under the last 4 years. I will be out of the territory next week in the nation's capital attending the Department of Interior's annual interagency group on Insular Affairs meeting and the annual winter meeting of the National Governors Association. It is important, these two meetings are important because the annual interagency group on Insular Affairs meeting focuses on all three territories and their involvement. What are the strong issues that are pushing and where we need help? This year we're going to talk a lot about energy. As you know, WAPA continues to be at the center of my attention as governor. We're also going to be looking at things as well as bond financing. Healthcare is always an issue in the territory. Of course, the National Governors Association meeting is a chance to interact with the governors and their staffs from all over the nation. And I think that's important to us as well too, because that's the way we find partnerships, build friends, and find common areas where we can work together. While there, I will also meet with executives from Google, Howard University, and the DC Mayor's Office to discuss strategic partnerships as we advance digital, health, and data-driven processes and decision-making here in the territory. I will also be testifying before the Senate Committee for Energy and Natural Resources, giving them a status update on the state of the territory. So a lot is happening over the next few days and few weeks as we continue on in pushing our agenda forward. We're hoping to speak to Senator Manchin, Senator Murkowski, great advocates for the Virgin Islands in the past, and of course working with the delegate to push our issues. As you know, the rum cover over issue has not been solved as yet. So while we do have wins like Medicaid match, getting it up to 83% permanently, we still have places where we need to win, and one of those being the rum cover over, hoping to get that done sometime this year. The challenge there right now is, in order to move that forward, it's called a tax extender. To move that forward, we need a piece of legislation to attach it to. So we've been communicating with the delegate, Stacey Plaskett, our friends in the Congress, our friends in the Senate, and of course our lobbyists trying to get that done too. While I'm there, I also meet with Lou Guerrero, who is the governor of Guam. We always take advantage of the, meeting with her and talking about some of the issues where we find in common, as well as Governor Pierre Luisi. And we have always traditionally gotten an opportunity to go to the White House, discuss with the president and the vice president, as well as cabinet members, some of the issues affecting small territories and islands. Joining me this afternoon is Commissioner Encarnacion for the latest COVID-19 data and information on where Virgin Islands residents can get a test, vaccine, and booster. But before I go to the Commissioner, I just want to remind the community that COVID is still very much out there. And I say that because as a victim myself within the last couple of weeks, you never know who you're going to meet, where you're going to meet. I am constantly ensured of our success by seeing, especially our seniors out there with your mask, continue to do that. And while this thing is now an endemic, we still need to keep up the common sense practices to protect yourselves and your loved ones, especially if your loved ones are elderly or just immunocompromised. So I'm asking you all out there to stay vigilant, as I'm sure the commissioner is going to echo those sentiments as I go to our health commissioner, who's staying kind of soon.
Good afternoon, everyone, and thank you, Governor Bryan. Happy New Year to each and every one of you. I am pleased to be back at the table to speak with you and provide the COVID-19 update. And as the governor said, yes, COVID is still part of our way of life. Today we have a total of 184 active cases territory-wide, 146 on St. Croix, 37 on St. Thomas, and 1 on St. John. Our hospitalizations territory-wide total 3 on St. Croix and at JFL, and 1 on St. Thomas at SRMC. The active case numbers are decreasing following our recent surge. In the past 4 weeks, we have had 2 additional deaths on St. Thomas related to COVID-19. Our thoughts and prayers are with the family and who have lost their loved ones. Our Christmas festival brought much needed time with family and friends. It satisfied our needs to just be outside and have some fun. It was also followed by a surge in active cases on St. Croix. We want to encourage the balance of emotional, social, and physical health, so we will continue to send out press releases reminding each of you to practice good hand hygiene, mask wearing at appropriate times, like traveling on a plane, and separating yourself when not feeling well. During the surge, there were some concerns about the accuracy of the Department of Health's daily COVID reports. We are aware that numbers in our report do not represent every active case in the territory, as many of us take home tests and those numbers aren't included in the reports. The purpose of the epidemiological public health testing is not necessarily to capture every case, but instead to identify the trends across the community. The daily increase in people seeking initial COVID-19 testing or confirmation testing, coupled with exponential increase in positives, provided the department with sufficient data indicating changes in the trends, and therefore prompted the Department of Health to adapt strategies to reduce disease transmission. For example, we already opened up our Emergency Operations Center in the Department of Health just to make sure that we were tracking, we were looking at the trends, and we're providing information on a day-to-day basis for you. So please rest assured that although not every active case was counted, the Department of Health was cognizant of our ongoing status, hence the increased numbers of press releases and radio discussions. Our agriculture and food fair is just around the corner, and the reminders and access to testing will continue. An important note about home antigen tests. These tests can be very helpful to identify positive cases. However, home antigen tests are not 100% accurate and can sometimes give a negative result when in fact COVID-19 is the cause of the illness. So if you continue to feel ill after receiving a negative test at home, please seek a PCR confirmatory test from the Department of Health. It's quick and it's free. Another benefit of getting a confirmation test is upon receiving a positive result, you immediately qualify for antiviral medication that can lessen the severity of the illness, possibly shorten its duration, and avoid hospitalizations. So if you are feeling sick and you receive a negative result on your home test, please don't take a chance. Get a confirmatory test. Again, it's quick and there is no cost. The bivalent vaccine has been specifically formulated to provide protection from previous COVID-19 variants like Beta and Delta, as well as the new Omicron XBB.1.1 and XBB.1.5 subvariants. It is very important to note, if you are not boosted, with the bivalent vaccine, you are not protected against the newest, more contagious variants. Everyone aged 6 months or older is urged to get the new bivalent vaccine. Remember that bivalent vaccine is now our best protection from COVID-19. Some of you may say, well, I've been boosted. Please check your card to make sure that you received the bivalent vaccine versus the booster that we got maybe like a year and a half ago. To date, there has been no confirmed cases of either of the Omicron variant. However, given the high numbers of active cases territory-wide, these variants on the mainland, we may soon receive confirmatory tests, these variants from samples that we sent to CDC for sequencing. Another new COVID-19 development relates to the treatment available for COVID-19. As the new Omicron variants emerge, CDC has found some of the tools healthcare providers have depended upon in the past are now ineffective. The monoclonal antibody treatments, for instance, that save so many lives are not effective for the Omicron variants and have been discontinued. If you recall, many of you went to the hospitals and received, some of you at home, received the monoclonal antibodies. That was very helpful, no longer available. And as of Thursday, January 26th, Evishield, a medication used for pre-exposure prophylaxis for COVID prevention, is no longer authorized for emergency use due to resistance against the COVID variants. The removal of these treatment modalities from our arsenal of tools to combat COVID-19 is why it's become even more important to get vaccinated and boosted with the bivalent vaccine now to protect yourself from exposure to infection. And as many of you may know, that the United States Virgin Islands have actually been one of the lowest in terms of vaccination rate for COVID-19. This has caused a problem for us, but really and truly it's a worldwide and a national problem. The reason why we continue to see the changes in the different variants is because we do not have the immunity levels throughout the world in order to combat COVID-19. Free bivalent vaccines are available through the Department of Health at the following locations: on St. Croix for adults, on the second floor of number 35 Castle Coakley, Unit 5, known as the Old Caribe Home Center building. The hours of operations of COVID-19 and influenza vaccine clinics are 9 a.m. to 3 p.m., Monday through Thursday. No appointments are necessary for vaccines. For information, please call the Community Health Clinic at 340-718-1311, extension 3760 or 3796. For children, vaccines are available at the Maternal Child Health Clinic, also in the Old Caribe Home Center building, number 35, Castle Coakley, Unit 5. For more information, please telephone 340-718-3111, extension 3201, or extension 3875. On St. Thomas for adults, vaccines are available in the Community Health Clinic on the second floor of the Snyder Regional Medical Center, Monday through Thursday, 9 a.m. to 12 noon and 1:30 p.m. to 3:30 p.m. Anyone wanting a flu vaccine on St. Thomas is asked to call 340-774-7477 to arrange an appointment. For children, vaccines are available at the Maternal Child Health Clinic. Appointments can be made by telephoning 340-777-8804, extension 2600. On St. John, vaccines are available as part of the Wednesday pop-up testing event conducted in the VI Port Authority gravel lot. Vaccines are available between 1 p.m. and 4 p.m. and testing is conducted between 12 noon and 3 p.m. Testing is free and remains available as follows: St. Croix, Monday through Friday, 9:30 a.m. to 10:30 a.m. in the Charles Howard Memorial parking lot. St. Thomas, Monday, Tuesday, Thursday, and Friday, 9:30 a.m. to 10:30 a.m. at the Schneider Regional Medical Center loading dock, and St. John on Wednesday from 12 noon to 3 o'clock p.m. as stated at the VI Port Authority parking lot. Now, don't forget, We'll also be putting this on the social media so that you'll be able to refer to those and jot those numbers down. Don't forget the importance of that. Before I turn it back over to the governor, I want to extend a public notice to everyone regarding Charles Howard. The Department of Health announces that pursuant to Virgin Islands rules and regulations, approved Federal Consistency Determination Letter CZX 522-FC, conditions number 18, a 14-day notice of construction commencement notice is being published to local newspapers and other sources. The project, FEMA project, Public Assistance PW 706645, includes the complete demolition of the main building and annex building and other permanent structures on the site, followed by the construction of the replacement building. The demolition scope includes a full clearing of the structures on the site, including demolition of the 3-story main building, 1-story annex building, and 5 other buildings, and relocation of other temporary structures on the site, such as the modular lab. The replacement building will be a state-of-the-art public health facility, which will be approximately 200,000 square feet in size. The new facility will promote health and wellness and house a range of clinical services such as community health, behavioral health, and family planning, as well as other public health services including environmental health, epidemiology, and vital statistics. The proposed project site is located at 35,000 Estate Richmond, Christiansted, St. Croix, Virgin Islands. The demolition scope of project will begin February 15th, 2023, my apologies, at 7:30 a.m. The project on site hours will be limited from 7:30 a.m. to 6:30 p.m., Monday through Friday, unless otherwise indicated. The project duration is 270 calendar days. Properly signed statements concerning the proposed project and addressed to the undersigned must be submitted via email to the Department of Health Division of Project Management and Capital Projects at doh.pmo@doh.vi.gov. Please note that we have had meetings with the public, individuals who are living within the area, as well as our government administrators, to ensure that everyone is aware of the project, and they will be meeting with us on a continuous basis so that if they have concerns will be addressed. Back to you, Governor.
Thank you, Commissioner, for that update, and congratulations on moving forward and getting Charles Howard demolished and getting that new building underway. Now, I have a question for people like me. How soon after you get COVID can you get the bivalent vaccine?
As soon as you recover. So we can sign you up right away, Governor.
Okay, so I can get mine this week.
You can get yours this week.
Yeah, I need to be COVID proof. I haven't been doing too well at that lately. But before I close this afternoon, I want to remind Virgin Islanders that tax season is upon us. The tax filing deadline this year is Tuesday, April 18th. So if you still need to do so, make sure you file your 2022 tax year income tax returns. Remember, we pay them as we get them. So the quicker you file, the quicker you get that check. We've been working hard to pay these returns at a steady clip. So make sure you file on time. I also want to remind tax filers of the Earned Income Tax Credit, which for many tax filers can mean the difference between having to pay back or receive a refund. For more information on Earned Income Tax Credit and whether you qualify, visit the Bureau of Internal Revenue website at bir.vi.gov/deductions. That's bir.vi.gov/deductions. I'll take any questions from the media if we have them at this point. I think Susan. Go ahead, Susan.
Good afternoon and Happy New Year. We're wondering about what the status of the Social Security checks are. It seems like there's still a lot of people who haven't received one. Do you know how many are left to issue and how many have been issued, and what is the holdup?
So we had a Social Security listing that Social Security provided us from 2020. Now that we've distributed check, we're learning that there were omissions. We still have 1,790 checks that haven't been picked up as yet. And what we're doing is we're going to try to figure out a way to reconcile and get the people who have not been paid yet to be paid. So we're working on that, but give us a break because it's budget season, it's taxi payout, it's income tax payout, and everything else we're paying at the same time. So just be a little patient. I know people have been calling OMB and they've been telling them that if you didn't get a check, you're not getting a check. But we're trying to work to get a new listing from Social Security, which is proving a little bit difficult. And if we can't get it, we'll figure out a way so people can register, and then we could verify their Social Security by either a check stub or something else and get those checks out to them. But the money isn't going anywhere. We're going to make sure everyone gets paid.
That's good. Just one more question. How do people know whether they're supposed to pick up a check or it will be mailed to them?
Well, I've been telling people, I know we've been telling people to call OMB. We're not mailing out any checks. So I'm going to make sure that they have a better helpline there, because I understand from people calling in, they have been getting busy or it just rings and nobody answers. So I got to do a little better job there, Susan, and get it together for those people who haven't gotten their check yet, our seniors. But we'll get them that. You'll look out for more information too. We're going to do some public education on how to get your check and all of that, so we could get people squared away.
Okay, great. Thank you.
Thank you. No more questions from the press. Just want to say a lot of things are going on in the Virgin Islands all at the same time. Isn't it exciting? The State of the Territory was great. Thank you all for your well wishes and your double down on an era of prosperity for us. Looking forward to things coming up in the near future. Lots of new announcements about things that are going on, so stay with us. I'll be in Washington, like I said, next week, and when we come back, hopefully we'll have even more good news for us to share with you. Other than that, be good, be safe, and love you. Have a nice day.